Hello, my name is Dr. John Abikala. I'm a surgeon in Austin, Texas, and the president of the Travis County Medical Society. The physicians of the greater Austin area have an urgent message for our community. Central Texas is now experiencing a dangerous surge in COVID-19 that just a month ago we had hoped we could avoid. In May and early June, we were seeing 50 to 80 new cases per day. In just 1 month, this number has spiked. Now we are seeing an average of 559 new cases every day. COVID-19 hospitalizations have quadrupled from less than 100 to 434 patients as of July 4th, and that number is doubling every 7 to 10 days. In March, April, and May, we proved that we could control the spread of the virus. For several weeks, we flattened the curve, and every COVID-19 patient received the best care possible. Our situation now is much more serious than it was in May because many more people are carrying the virus and many more people are getting sick. To make matters worse, today's surge is the result of viral transmission that occurred 2 to 4 weeks ago. Even if we take action now, it will be 2 to 4 weeks before we see the effect. This is like trying to stop a train or turn a cruise ship. In 1912, a cruise ship called RMS Titanic entered an area of the North Atlantic called Iceberg Alley. Rather than slowing down, the captain continued to steam forward at high speed. Action was taken only when it was obvious that an iceberg lay dead ahead. By that time, the crew's efforts to slow and turn the ship were futile. We all know what happened next. If COVID-19 hospitalizations continue to double at the current rate, in less than 3 weeks, our healthcare system's capacity to care for patients will be exceeded. We will experience shortages in 3 areas. First and foremost, there will be a shortage of trained healthcare workers. Today, our nurses and doctors are stressed, but they are hanging in there. If this surge continues, in 3 weeks, they'll be overwhelmed. Second, the medicines needed to treat patients with COVID-19 will be depleted. We are working hard to manage a limited supply. Already, we face shortages in convalescent plasma and drugs like remdesivir. Third, if this surge rages on, we will be out of space in our hospitals and ICUs, and patients will have to be cared for in alternative sites like the Austin Convention Center. Once our healthcare system is overwhelmed, the best possible care can no longer be provided to each patient. Terrible decisions will have to be made about who receives care and who does not. None of us in the medical community want to be forced to make those decisions. 1,517 people died on the Titanic, and we still talk about that more than a century later. In Texas, if the pandemic continues unabated, our death count will start to look like New York's body count of over 31,000. Texas is on a collision course with a viral iceberg, but we don't have to sink. We can slow down and change course. We must do it now. We must wear masks in public. We must keep our distance from others. We must frequently wash our hands, cover our coughs, and refrain from touching our faces. We must minimize our casual and recreational contact with other people. We will have to do this for a while. No one knows for how long. But we can do it. We must do it. I welcome my colleagues now who represent thousands of physicians in our community working together to fight COVID-19.
Please stay home if you can. I am Dr. Annie Pena, anesthesiologist, Austin, Texas.
Please wear your mask in public. I'm an Dagestani and internal medicine physician.
Please cover your mouth when you cough. I'm Dr. Garrett Scales, anesthesiology.
I'm Dr. Tony Aventa, internal medicine. Please do your part to help us stop the surge.
Please refrain from touching your face. I'm Dr. Tina Phillip, family physician in Round Rock.
We can do this. Let's kick COVID in the butt. I'm Dr. David Flieger, and I should know. I'm a colon and rectal surgeon.
Please keep your distance from others. I'm Dr. Harris Rose, orthopedic surgeon.
What starts here, this little thing, can change everything. I'm Clay Johnston, neurologist and dean of UT's Dell Medical School.
This is Dr. Linda Cox. I'm an obstetrician gynecologist. Please wash your hands frequently. Palm side, knuckle side, nails if you can. Central Texas, let's stop the spread of this virus together.